I think this policy is really concerning for consumers.
Public outcry over United Healthcare's new policy.
I hope that they back away from this policy entirely.
A policy to crack down on ER visits.
Emergency care is complex. You got a lot of different things, moving parts, different types of bills.
Why they may not cover your next ER visit, leaving you on the hook for the cost of care.
You may end up with the lowest income, low wage workers having the most outsized impact of a policy like this.
Tonight, a deeper look at who this affects, why they're making the change, and what you can do if you're in this situation.
Some are calling it dangerous, others are calling it garbage, but United Healthcare says its new policy will help them save millions of dollars.
They're hoping this policy will force people to seek medical attention with a primary care physician instead of going to an ER. Denver7's Sloan Dickey is taking a closer look at that policy and what it means for your cost of care.
I think this policy is really concerning for consumers.
Public backlash over a new United Healthcare policy scrutinizing claims for emergency room visits.
This will end up discouraging use of the ER when somebody might actually need it.
According to the policy, United Healthcare would take a closer look at emergency room visits to determine if the visit was in fact a medical emergency. If they determined it to be non-emergent, the visit would either not be covered or there would be limited coverage.
It's hard for your average person to know whether the insurer will think it's an emergency, whether the ER might think it's an emergency. And it really makes it challenging for consumers to know whether they should go to the ER or not.
United Healthcare says their goal is to crack down on unnecessary use of an ER. According to a 2019 study, the company says some of the most common conditions treated in the ER include cough, flu, dizziness, headache, and back pain, and that 27 million of 46 million annual visits to an ER can be treated by a primary care doctor.
It makes the assumption that all consumers can have the choice of not going to the ER and going to other lower intensity sources of care, whether that's primary care doc or urgent care. And that's not a fair assumption.
The American College of Emergency Physicians called the new policy dangerous in a statement asking the company to remove the policy. The American Hospital Association said it would have a chilling effect on patients seeking emergency service. Adam Fox with the Colorado Consumer Health Initiative agrees.
I hope that they back away from this policy entirely because it is fundamentally harmful to consumers.
He believes it would disproportionately affect some Colorado communities.
You may end up with the lowest income, low wage workers having the most outsized impact of a policy like this, and that is fundamentally unjust.
United Healthcare says avoidable ER visits cost the healthcare industry nearly $32 billion annually and says it's driving up costs for everyone.
Because it's a 24/7 service and because it can literally bring anything to bear to manage a situation, that's why it's expensive. More expensive than a primary care office.
Emergency room physicians like Dr. Eric Hill of the Aurora Medical Center say all urgent health concerns should be attended to.
Emergency care is complex. You got a lot of different things, moving parts, different types of bills may be involved between the hospital, the emergency physician, possibly radiology.
He says there's some things patients with insurance can do to prepare, including establishing a relationship with a primary care doctor.
A lot of people that have insurance have never actually established a primary care doctor because they otherwise feel healthy and they just don't go to their routine annual physicals, even though it's basically an entitled benefit in most insurance plans.
Sloan Dickey, Denver7.
And a big question is, how will the insurance company decide which claims to accept or reject? The insurance company will look at things like initial concerns that led you to the ER, pre-existing conditions, or the care and services provided in that ER. But let's take a closer look at why this isn't so black and white. The CDC is reporting that 3% of emergency room visits are non-urgent. 90% of symptoms between an urgent medical condition and non-urgent overlap. The American College of Emergency Physicians says they think this policy is illegal. The group is still suing over a similar policy introduced in 2018 by Anthem, but they haven't said if they would take legal action in this case. And looking closer at that 2018 policy, Anthem announced it wouldn't cover emergency room visits if the medical condition wasn't an emergency. like United Healthcare, they believe emergency rooms are an expensive place to receive routine care. So in the end, patients were left on the hook with the bills. The lawsuit in this case is still pending. And as for United Healthcare, they say their policy complies with federal regulations and the layperson standard.
So what is the prudent layperson standard? Well, it's a federal law that protects patients, ensuring anyone can receive emergency care regardless of insurance status or ability to pay. It requires insurance companies to provide coverage for emergency care based on symptoms, not the final diagnosis. So, for example, if a person goes into the ER with chest pain, thinking they're having a heart attack, but it's just an anxiety attack, not a cardiac event, that ER visit should be covered according to this standard. United Healthcare says their policy is consistent with this because a provider has the chance to attest to that medical care.
And we're already seeing the backlash on social media over United Healthcare's policy. Seth Truger is an ER doctor in Northwestern Emergency Medicine. He's also the digital media editor for the JAMA Network Open. And in a tweet, he called the policy garbage, writing, "This will throw babies out with the bathwater." Philip wrote on Twitter, "I've started treating post-hospitalization UHC nurse check-ins like Mirandized police interviews. Anything I can say and will be used to deny me coverage. They're not interested in helping, just profiting." Another person writes, "Why do they get to deny claims? Their job is to pay, not make medical decisions."
So let's take a deeper look at what happens if your claim is rejected and the insurance company deems your ER visit as non-urgent. Well, you can challenge that decision. The patient must submit a formal appeal, and like we mentioned, a provider can also attest to the emergency needs. If that is submitted in the given time frame, United will cover that visit.
And originally the change was going to go into effect July 1st, but after public backlash, today United Healthcare decided to delay the start of the policy change until the pandemic has ended. So it's not clear what they'll do next. In the meantime, we want to hear from you. We know the cost of care is so hard to navigate. So email us your thoughts at 360@thedenverchannel.com.
Well, just a couple of days after the legislative session wrapped up for the year, we are now learning that a Senate Republican is facing an ethics investigation.
Denver7 political reporter Megan Lopez breaks down what the ethics complaint is about.
So that ethics complaint was filed back in April for some comments that Senator Bob Gardner made in 2019 during a joint session of the Judiciary Committee. It wasn't until after the legislative session wrapped up this week, however, that Senator Leroy Garcia responded to it in a letter and said that he is going to assign a committee to investigate that complaint. However, Chris Forsyth, the man that filed that complaint, says it should have happened much sooner.
I'm writing to file a formal complaint against Senator Bob Gardner.
This is a story about a letter, a complaint filed over comments made in 2019 on the record.
I had about 5 or 6 years ago a colleague.
A story Senator Bob Gardner told about helping a colleague reach out to the judicial branch to highlight the need to hold judges accountable.
I was able to make a phone call to the state court administrator, but had my colleague not shared office space with a member of the House Judiciary Committee, she would have been faced with a recusal motion.
My jaw dropped.
A story Chris Forsyth from the Judicial Integrity Project says raises serious issues, just not the ones Gardner was trying to address.
No one should be able to make a phone call and get a different judge on a case.
This story comes as another plays out in Colorado's highest courts. One about sexual harassment, discrimination, and a questionable contract. Those allegations will soon be investigated.
If I may, Madam Chair,
on the commission picking that investigator, none other than Senator Bob Gardner.
He's made the admission that he's used the state court administrator to help a friend get a judge on the case, and now he's supposed to be investigating the judicial branch. It's already raising eyebrows.
This is also a story about a bill Gardner co-sponsored, a bill that allows retired judges to fill in, something Forsyth says gives the Chief Justice more power. He believes it's another conflict of interest, so he filed that complaint. In a letter sent Wednesday, Senate President Garcia started a committee to investigate Gardner. He assigned Senators Lee, Winter, and Gonzalez. Minority Leader Chris Holbert assigned Senators Cook and Lundeen.
I believe that they will be able to resolve this very quickly.
Senator Holbert couldn't speak in detail about the complaint due to confidentiality. This ethics committee will be the first formed since the rules changed in 2018. The rules say unless Gardner demands a quick decision, there's no timeline for the ethics committee to offer a recommendation. Megan Lopez, Denver7.
Right now, our community is gathering to remember Isabella Thallas 1 year ago to the day. Isabella was murdered. She and her boyfriend were out walking their dog in Denver's Lodo neighborhood when a suspect started shooting at them. Isabella had just turned 21 years old. Her boyfriend was also shot and had to undergo multiple surgeries, and he survived. Coming up tonight on Denver7 News at 10, I sit down with Isabella's mom, how she's doing a year later. And our Denver7 investigative team is also looking into the case. The new information we are learning about the relationship between the suspect and a former Denver police officer.
Right now, a wildfire is forcing evacuations in Jefferson County and the Ramona Gulch and Dome Rock area just south of Conifer. Officials are calling it the Platte River Fire. And that fire has just grown from just 4 acres to 20 acres in the last hour. The Jefferson County Sheriff's Office says this fire may have started from a downed power line on Platte River Road. Evacuees are being told to go to Conifer High School. We have a crew headed that way, so stay with Denver7 for updates.
Torrid temperatures today. Tomorrow's a bit cooler, but hot again for the weekend.
Nobody knew I was going to go to the grave as a straight person.
A nearly century-long battle, but this 90-year-old says it's time to show his true colors.
It's a freedom that I received from coming out that made it possible to really start enjoying life.
Tonight, even through the pandemic and virtual gatherings, the Center on Colfax has proven to be a lifeline for the LGBTQ community.